Why lateral? Many people ask me why I prefer a lateral approach for posterior lateral arthrodesis or fusion of the lumbar spine. We have patients with instability, spondylolisthesis, stenosis, and there's options out there for those patients, but why do I prefer the lateral method? Well, number one, we preserve the multifidus muscle. I think that's a very important muscle for stabilization and it's preserved with the lateral approach. Number two, we preserve the supraspinous ligament, which really acts like a rubber band to really help stabilize the spine. And I think having those two structures preserved is very, very important. Thirdly, I think the risks are certainly reduced. We're going in an area laterally where there's very few blood vessels there, and we also are not going towards the spinal column itself. So I think those two things improve safety overall, in my opinion. So why lateral? Well, the other reason is my surgeons have really found it helpful. They've been referring patients to see me who have grade 1 spondylolisthesis, who really don't need a larger fusion, and we've seen great outcomes in those patient populations. For the younger patient who doesn't want to undergo the risk of a bigger surgery right now, who's still grade 1 and with mild to moderate stenosis, often a great option. And then there's older patients with comorbidities. This approach really is well tolerated by most of the folks who are in their 70s or 80s or even 90s who have comorbidities. It would make it difficult for them to undergo a larger surgery. So why lateral? There's a multitude of reasons, but the number one reason is my outcomes have been phenomenal, and I think the risk of the patient is markedly reduced. And I think the long-term stability of the spine is preserved much more with this approach than other options that are available. That's why I choose lateral.